So again, welcome. My name is Tenselberg. I'll be one of your moderators for the presentation today, alongside some of my colleagues, Sarah Connors, the Customer Success Lead at Anytime Pediatrics, and Darby Ting-Yu, the Customer Success Manager here at Anytime Pediatrics. We have some of the patient engagement champions in our Anytime Pediatrics community that we're excited to have share some of their insights with you. And so we'll start with Emily Chantry from the Just for Kids Urgent Care out in Idaho. She is the Director of Marketing and Events at Just for Kids Urgent Care. Kevin Pelchat is the Operations Analyst at Peachtree Park Pediatrics. And Caroline Morgan is a physician pediatrician at Pirate Pediatrics in North Carolina. At this time, so I'll turn things over to Darby Ting-Yu to talk a little bit about success at Peachtree Park Pediatrics with Kevin.
All right. So I'm Darby. Like Pencil said, I'm a customer success manager here at Anytime. So I'm excited to hear from Kevin Pelchat, an operations analyst at Peachtree Park Pediatrics. He's going to dive into some of their practices, patient engagement strategies, and success that they've seen communicating their telemedicine offering to their patients, whether that be over the phone, on their website, email communication, and more. So I will hand it over to Kevin.
Good morning, everybody. Thank you for having me. Again, my name is Kevin Pelchat. I'm the operations analyst at Peachtree Park Pediatrics. So yeah, first, just a little bit of background about our practice. Peachtree Park Pediatrics, we are a private practice, 7 physicians. We have about 10,000 active patients, and we first started offering telemedicine back in April of last year as a response to COVID and the decrease in demand for patients wanting to actually come into the office. We started with a product called ExamMed, and then in September, we switched over to Anytime Pediatrics and have been using it ever since. Next slide. So here are some of the things that we've developed to have a successful experience with implementing Anytime Pediatrics and really communicating not just with the patients, but establishing an effective and streamlined workflow within the office too. So ever since COVID hit, scheduling has become a tandem effort between the nurses and the front desk staff as far as sick visits go. Front desk still handles all the well visits as they normally would, but now with sick visits, everything gets triaged through the nurses to try to determine if it's something that they need to come in for, or if it's something that can be handled over telemedicine. In which case, that's really the first, outside of the initial mass communications that we sent out advertising that we're now working with Anytime Pediatrics. This is really the first time that the option for telemedicine is advertised to patients is while they're on the phone with the nurses. So outside of sick visits, another thing we do to try to promote our telemedicine offerings are we will send periodic blast emails to patients with chronic conditions, including asthma, ADHD, depression, anxiety, anything that can really be addressed in just a conversation via a telemedicine call with one of our doctors. As far as communicating with patients, we found that in order to really help bridge the gap between offering them the telemedicine visit and then actually successfully starting and completing the call, we found that communicating early and often is best with them. We've got multiple resources, not just on our website, but also in previous communications, where an automated message will go out to the patients with clear, concise instructions on what they need to do and what they should expect and what we expect from them as patients in order to have a successful call. Because as all of you have probably learned over the last year, technology is not perfect, but unfortunately that's the reality that's been thrust upon us. So again, just redundant information, kind of beating a dead horse and making sure that the patients know everything we expect from them and everything that we need to possibly have a successful call. And with that comes transferring responsibility from us to the patients. And what we're really trying to do here is by transferring the responsibility to them, what I mean is that we ask them to create the account ahead of time. So while they're on the phone with the nurses, we ask them to create the account, and then once that's done, they call back, and that's when the front desk staff will really walk them through it and not just set up the appointment in Anytime Pediatrics, but also really go over those instructions again and tell them what we expect. So again, kind of just reiterating the fact of the most important thing is getting the word out. Our nurses are offering the telemedicine appointments to eligible patients once they're on the phone with them and triaging them. Again, that's mostly the patients that are patients who have a rash. We spent a lot of time when we first implemented telemedicine identifying which populations we were going to make eligible for telemedicine calls. Pretty much anything that's not contagious or anything that you would feel comfortable diagnosing and treating over a call. And really, we primarily use it for follow-ups for, again, those chronic conditions, asthma, ADHD, depression, and anxiety. And again, when volume's running a little low, or really we'll do it quarterly more so than in response to low volume. But we'll send out mass communications to all those patients with those chronic conditions who haven't been in for an appointment, to just remind them that it is available, that they don't have to come into the office, and we can utilize this resource that we're offering. And as far as patient prep goes, again, we have the front desk staff is really the front line of not just preparing the patients in the first place, but also offering support. They're going to walk the patient through setting up the appointment to make sure that they have successfully created the account. And just to kind of double check our own work, the day of the appointments, every day we'll go through and we'll see which telemedicine calls are scheduled for the day, and we'll go into Anytime Pediatrics and we make sure that those patients have in fact set up. And a lot of times it ends up with a phone call to the parent to remind them that, hey, you need to finish registering your account. I see that you haven't signed on, and just making sure that they're comfortable to proceed with the call. Yep, and here's a picture of our website. This is our homepage. What we have here is like a slider panel, and it'll show different news articles and stuff that's going on. And so this has been here ever since our telemedicine, since we first launched telemedicine appointments. And here they can gain some basic information, a lot of the things I just covered, in addition to being able to actually register their account. So this is where the front desk staff will guide the patients. And as you can see, there's some points here that are highlighted. There's a box over using the registration code, and that's something that we reiterate over the phone, but also provide here so patients can have a seamless registration process. On to our takeaways, best practices. Again, internally, what we try to do is, what really helped us integrate or implement telemedicine in the first place was identifying where we stood to succeed in the first place. And again, that was identifying the 7 physicians, deciding what they wanted to do and who they wanted to really reach out to. And what we ultimately came across is, we're not going to offer these. Patients aren't allowed to. We're not offering them throughout the day. We have 2 appointments per day per doctor, right after their lunch time. And that really helps keep not just the patients ready, but the doctors as well. They know what to expect. It's on their schedule at the same time every day. And in addition to that, where I mentioned that it's a tandem effort between our nursing staff and our front desk staff, what we've tried to do is we've really outlined who's responsible for what, and it really helps bridge the gap, because these are 2 different entities that don't necessarily work hand in hand all the time when it comes to scheduling appointments. Normally that's 100% the front desk staff, but what we tried to do is we tried to eliminate the siloing that comes naturally from bringing 2 different groups that don't always work tightly together, and asking them to share responsibilities. And then as far as best practices for communicating with patients, again, I've covered all of it, as far as how we try to communicate with them early and often, transferring that responsibility by letting them know that they have the account. They need to be logged on and be present in the call at a certain time prior to their appointment.
Thanks, Kevin. I'm Sarah, Customer Success Lead here at Anytime Pediatrics, and I have the pleasure of introducing Dr. Morgan today with Pirate Pediatrics. I'll let her take it from here, but her team and her practice have been great about communicating with patients to let them know about their on-demand telemedicine offering on the weekends, and we'll let her share her tactics for letting her patients know when she's available. I think you might still be on mute, Dr. Morgan. Okay. Probably the most common term of 2020.
Thank you so much. Thank you all for inviting me to do this. It's a wonderful opportunity, and thank you for all of those who are taking time out of your day to join. Happy Doctors Day to all of you doctors out there who may be listening. Um, Anytime basically has been our platform from the beginning, and it definitely saved us, honestly, and our patients throughout the pandemic. It was something we had been interested in. However, due to insurance constraints and laws of where it had to be done, it had been limiting up until that time. And then the floodgates just opened with the pandemic. So one positive thing that came out of that was telemedicine for us and for our patients. Where we are in North Carolina, sometimes our patients travel. Not commonly for 45 minutes at the time, one way to reach us. And some are all the way out in the very far reaches of the coast with no pediatrician or one that they feel comfortable with, and they'll drive in an hour and a half one way. So this was definitely a lifesaver for them and for us being able to reach them. And so we had to come up with some creative ways of how to reach these people to let them know that we could see them, even though they might not feel comfortable coming into the office. So we had different ways of communicating, both externally and internally. You'll learn in my next slides or so that the internal is honestly the best way, but if they can't get there, then we've had to rely on these external ways. So one of them is our website. If you are to go to our website at piratepediatrics.com, you'll see currently it's on a landing page because we're in the middle of a new website revision. And on that new website, there's an entire page on telehealth and some videos that Anytime helped us with to better explain how to get on and to make it more comfortable for parents to see that it's not such a scary thing. So that is one external way. The other external way that we communicate is through social media. So you'll see back here on December the 8th of last year, we put out something on our Facebook page, showed what Anytime looks like, and just tried to make that easily accessible and comfortable for patients in that way, and let them know what it could be used for. We tried to use it for anything, and at the beginning we would allow a telephone visit until they got a little more comfortable with this under their feet, and then we switched everyone over to telemedicine. So we have a platform, it's working great, we'd like to see you, and so we highly encouraged them and shifted them into that mode of communicating with us through telehealth. As far as internal goes, originally what we did was we just took the big iPhone screen that said Anytime on it. We blew it up really big and we put it on every single wall in each exam room, in the waiting room, for one family who was isolated in there. And so then when we would talk in the exam rooms with patients, we would point to it and say, hey, this is a well visit, but if anything comes up, you have a rash, you have this, you have that, you can use this online platform called Anytime Pediatrics to reach us. And it's really us on the other side of the screen, not someone that you don't know. So we had that, and we would communicate with them what it was and what it was used for, what our practice code was, gave them an easy way to remember it. It's the last 4 digits of our phone number. So if they forgot it, it was right there, directed them to our website, basically handheld within the room. We also have a TV monitor, doesn't play TV, it's just basically circling announcements of like a PowerPoint. And we would have that Anytime platform photos and things like that in the waiting room as they were there also. But honestly, if I could recommend anything or share with what we did that has been really successful, is when we have an appointment in the room, the provider will say, we could do this telemedicine if you'd like to next time. You could take a picture of the rash up close. You could take a picture of the acne. We could see how, we're following it. Is the medicine working? Is it not? And I would say most of the people take us up on that. And then there's a few that want to come in person still. And so we just have designated times where, for instance, I'll do it on Wednesday afternoon, and I explain to the patient that I'm sitting in front of the computer, and so it's visit after visit after visit, and you don't have that wait time that you have when you come in the office. And so we can hop on, we can hop off. You can do it in your car while you're waiting to pick up your child from school. You can do it in your dorm room. You can do it. I did one college dorm room in Mississippi yesterday. Definitely not able to come back. She was an ADHD follow-up. Worked really well. And I would just encourage anyone to think about that way as communicating the telemedicine to their patients. They believe that you believe in it as a provider and you're comfortable with it and that it works well. They will definitely give it a try. The difficulty we've had in North Carolina is not everyone has great internet service or access, and sometimes the calls can't even get started, or they get dropped, or we can't hear each other, or things like this. And that's not anything to do with the platform. It's just, our connection here. And so if they ever have a successful visit, it is very, very beneficial. So for instance, I was typing in an email to these lovely ladies that an incident that had happened the day before, and it's out there for you what the mother said, but she just got on and she just lit up and said, "This is fun." It was her son. He was a newborn. He had rash all over. She's one of those that lives over an hour away, didn't want to come back in. And so essentially a year prior, she had had an unsuccessful visit where we ended up having to speak over the phone. But because she didn't want to drive, it was her third child and didn't want to get him out, she was willing to try it again. And I don't know if her internet got better, what happened between then and a year ago, but she had great things to say and will likely use it again. So honestly, if they have success with it and you're behind it as a provider, and you think it's great, and then it just works and it clicks well. The other piece that I didn't put in here is financial. So if their insurance is covering it, they're all about it. So anytime anything has to be out of pocket, that poses different challenges. So in North Carolina, Medicaid is covering it, and pretty much all the private payers that we've come across are also covering it at this point. So we are excited to have it, and we hope that we can continue to keep the payers on board and keep it going.
Thank you so much, Dr. Morgan, and a very happy National Doctors Day to you as well.
Oh, thank you.
And to all the physicians that we have joining us today. And so now we will shift to welcome Emily Chantry from Just for Kids Urgent Care. Emily has a unique perspective that might be a little bit different than the primary care, but very similar in marketing to parents and patients. We've just been so impressed with some of the videos that you all have created and some of the work you've done in promoting telehealth. So wanted to invite Emily to share a little bit about that today. Hi, Emily.
Hi, thank you so much. Can you hear me okay?
Sounds great. Absolutely.
Perfect. So yeah, we definitely have a little bit of a different experience than, a primary care provider. That's one thing that we love, being a pediatric urgent care. We work with the primary care providers, but we find that we're kind of in an area where there's a lot of people that come to Jackson Hole, or they come to the Tetons or things like that. And sometimes they're in this area and they'll have accidents, or they'll get rashes or burns or things like that. And we've found that it's really helpful sometimes for them to jump on a telemedicine call, and we can see it. We can say, hey, yeah, you need to bring them in, or no, this is how you can treat it, things like that. And it's kind of a good, I guess, in between to help families know if they actually need to bring their kiddos in, or if they're okay and they don't they don't actually need to be brought into the clinic. So we actually just opened our doors about 3 years ago, and we started doing telemedicine or using Anytime Pediatrics in summer of 2019. So we started before COVID happened, and we kind of had the same problem. We had a hard time getting people to really embrace it and to be okay with it. And especially in an urgent care setting, we don't have consistent patients. We have people who come back, but only if they need us. Ideally, we don't want patients to have to come because we want them to not get sick or have injuries or things like that. But when they do, especially for families that have a lot of kids, it's been really cool for them to be able to call instead of having to bring all the kids in, and it doesn't even need an x-ray or it doesn't need stitches, things like that. And so for us, we just focus on trying to kind of bridge that gap a little bit and make it easier for our patients and their families, just because it really can be so scary as a parent if you need urgent care services and to not know if you do need them or if you actually, would be okay to just put a Band-Aid on it and wait a couple of days and see. So we've done a lot with social media. That's been a big way that we've tried to spread the message, because we feel like educating people about these services is kind of the biggest holdup that we have, because a lot of people either don't know we offer them or aren't sure how they can be used. So on the next slide, it has a quick video that will show that we had created for telemedicine.
Just for Kids Urgent Care is a state-of-the-art, child-friendly healthcare facility. Our providers are pediatric specialists who want to help you help your kids feel better. As East Idaho's only pediatric exclusive urgent care, Just for Kids is built and designed with kids in mind. Receiving safe, convenient medical help for your kids is more important than ever. Virtual or telemedicine visits are simple, convenient, and easy to do. Virtual visits allow you to video chat with a Just for Kids provider from your computer, tablet, or smartphone. In a virtual visit, you connect to a pediatric provider who can diagnose, treat, and if needed, send your prescription to a local pharmacy. No matter where you live in Idaho, Just for Kids telemedicine brings the doctor to you. Virtual visits don't take as long, so your child can spend less time waiting and more time getting better. Through virtual visits, no Idaho parent is without access to premier pediatric care for your child. Although telemedicine is a virtual visit, that doesn't change the high level of care each child receives. All Just for Kids providers are specialized in pediatrics because we believe that little patients are a big deal. Virtual visits at Just for Kids allow you access to medical care wherever you are, whenever your child needs it. Just for Kids Urgent Care, bringing parents peace of mind.
Thank you. So we found that helping our patients and helping the community know what telemedicine is and how they can use it has been huge. Just educating, we've done a lot of polls on Instagram stories, things like that, to see if people have ever used telemedicine or virtual visits, how comfortable with they are with them. And we found that a lot of people have heard of them, but have never used them or are very uncertain about them. And so we've done a number of posts and stories and videos just to try and help people kind of help bridge that gap in education, because from an urgent care perspective, it's a little different because we don't have patients that we can say, okay, we're going to schedule your next visit on us virtually, we're going to schedule it through this app or things like that, because people just come in when they need us. And so it's been really fun, and it's been interesting just to kind of put that education out there and to find creative ways to just to help people know it's an option. And Caroline, I love how you have posters in your rooms. We did kind of a similar thing where we've got a little poster on the back of each door that says, it's the same doctor, same care, same level of service, but just from the convenience of your home. So that's kind of our experience with it. And it definitely is different as an urgent care, but it's been a really cool opportunity.
Awesome. Thank you so much, Emily. And thank you to all of our panelists for joining today and also for agreeing to stick around for a little bit of Q&A. So please do feel free to submit any questions. I know, Stephen, you have shared some questions. We appreciate that interactivity on the chat. You can also use the Q&A portal. So we just have about 4 or 5 minutes if you would like to submit any questions for our panelists. And Dr. Morgan, Kevin, or Emily, do you all use your phone systems at all? So like voice messages or on hold greetings to inform your patients about telehealth?
I don't think that we do. We only do the telehealth during our open hours. And so typically if someone calls when we're closed, we don't offer either one. But I do like that idea. I don't know if other people have used that, but I don't think we have so far.
I don't think we have either. I think that is a fantastic idea. The way that we communicate when our on-demand hours so far has been through Facebook, and we'll put it up. And then also you can set your hours in any time, you know, for the on-demand visits. We'll do those for both Saturday mornings or Saturday, anytime Saturday. And then also like if there's a snow day or we're canceled for flooding or whatever reason, we'll also do those. And then if volume gets slow that day, we'll open it up also for on demand. But that is a fantastic idea. I will take it back with me.
Perfect. And Dr. Morgan, hearing you talk about the mother that had connectivity issues and then had those resolved in the second round made me think about that may have been due to a new feature that we developed within the platform. So before that parent comes into the visit, we've developed a feature where in the background, we're checking their connection. So if their Wi-Fi signal is weak, they'll receive an automated prompt to tell them that it was recommended to go to maybe a mobile network, and vice versa. If they're on a mobile network that's weak, they will be recommended to switch to a Wi-Fi network.
Very
So we're
nice.
finding that's helping a lot of parents and patients get connected seamlessly. We do appreciate again, Dr. Morgan, Kevin, and Emily for joining us and sharing your insight.